Welcome to Health Focus, where we focus on your health. I'm your host, Dr. Scott Anderson, and today we're focusing on cannabis in youth. Some people say cannabis, some people say marijuana, but we all know it as basically being the same thing, a commonly used drug. And in fact, many of us have opinions about it. It's been used both therapeutically and also recreationally, but certainly it's been with us in a very prominent way in recent years and for many years. In fact, scientific research indicates that among Americans, 46% have used cannabis at some time during their lives. 18% have used it within the past year. And the use rate is higher in certain groups. For example, in men aged 18 to 25, 35% report having used cannabis within the past year. Worldwide, in the year 2019, a scientific study showed that 200 million people had used cannabis, or 4% of the world's population. So given our interest in really working on your behalf to give you the information you need to make intelligent decisions in your life, we're focusing today on cannabis in youth, or marijuana in youth. We're very fortunate to have with us today a very distinguished guest, Bart Bright. Welcome to the show, Bart. It's really a pleasure to have you with us.
Thank you, Dr. Scott. Yeah, really glad to be here.
And I know from talking to you and meeting you that you're an educator, that you were with, I believe, the Mount Diablo School District.
Correct.
And that this subject is something that you've encountered in your life. I imagine as an educator, in fact, you probably encountered this as something of concern.
Yeah, when I substitute taught, I was aware of it because sometimes the kids would come in, smelling like cannabis, or I might see them, out at the parking lot as I'm, driving away after I taught. And so I know it's, popular with a lot of, kids in schools and especially high school and college.
And you indicated too, when we were talking offset, that in California, cannabis would be a preferred term, you think, as opposed to marijuana. I'm kind of used to marijuana, but they're interchangeable, right?
Right, and I think because cannabis dispensaries have opened up, many people say cannabis, but then when they're talking about the medical marijuana, obviously they say marijuana. So
right. And I'm familiar with the issue of medical marijuana use. In fact, I go to a clinic in Oakland where there's a dispensary under my clinic, and I've been struck by the amount of secondhand smoke I encounter. So that's something that I'm aware of. Also, I'm aware that there are some prescription drugs that contain some of the pharmacologically active agents in marijuana. And then, of course, there are herbal supplements that people prescribe.
Right.
And this has become something of a contentious issue, but the pendulum seems to be swinging towards wide use of marijuana, at least at this time, whether on a medical or recreational basis. And I understand that your own family life has been touched by this, and although I realize it's a very painful subject, I wonder if I could prevail upon you to share a little bit of your own experience in this respect.
Yeah, I'd like to. So I started smoking in college, and that was in the 1970s. And I would basically call myself a pothead when I was a senior in college. I smoked every day, almost every day my senior year. And it definitely affected me. I had less motivation. My girlfriend told me that she saw my personality change. I was angrier more often, and usually I was very easygoing when I wasn't smoking. And so it's kind of the opposite of peace and love and everything's mellow. And so for me it didn't work. It didn't help. It actually was a negative. And then fast forward, my son Kevin started using it when he was 15, and he came to us, and thank God he let us know that he was using it. And we right away got a counselor, a therapist, and to work with him, because it was actually affecting him in a very negative way. It was making his depression worse, his anxiety worse, and so fast forward, he kept using it off and on, and we didn't condone it. In fact, when he was 18, we asked him to leave the house because he was using it, and that was something we didn't think was good for him. I had no idea, though, that it was as serious as it was, because I'd always heard that it was no big deal, it was natural, not addictive, and all that. I knew it wasn't good for them, but I didn't know it was as big a deal as it was.
And of course, when you talk about marijuana, really it's the third most commonly used recreational drug or psychoactive drug that people obtain on their own, after alcohol and tobacco. So one might say, well, nothing's perfect, all drugs have side effects. But I understand from talking to you that in the case of Kevin, things really got out of hand in a much more serious way, suggesting that, as is the case with alcohol and other drugs, in some individuals, this could really be bad news.
Exactly. He became addicted to it, and I've learned since that time that many people actually do become addicted to it. And the rate is actually very high compared to many other things when they start using it at a young age, in their teens. And especially today's high THC cannabis is more addictive than it was, let's say, at Woodstock in 1969. They say the average was about 2% THC. Now a lot of young people are they're vaping or dabbing cannabis that's 60, 70, 80, sometimes 90% THC.
Okay, so Kevin is using the substance, he's getting kind of habituated to it or addicted to it, and then what happens?
So then, unfortunately, he built up a resistance, resistance to it, and used more and more to get the same high. And he eventually got to the point where he was so miserable that he tried to take his life. And we did everything we could, again, through psychiatrists and therapists and all that, to try to help him. Unfortunately, at 29 years old, August 14, 2018, he died by suicide.
It's really tragic. I hate to even ask you about it, because I could see in your face how painful that is. But I know that you've taken this tragedy and you've tried to make something positive out of it by kind of serving as an educator to the community in this area, right? Yeah,
so again, because I had no idea about the psychological effects of cannabis, the THC. I knew, of course, it affected me when I used it, and it was, again, I probably used 5% THC when I was in my early 20s, but I had no idea about the heavy duty, again, 60 to 90% THC cannabis. And so what I started doing, I started researching it, and I found some websites, and one of them was called Johnny's Ambassadors. And on Johnny's Ambassadors, Laura Stack, who also lost her son to suicide, she wrote this book, and it's about her son, and this story is very similar to my son's story, and he ended up taking his life at 19. He's a 4.0 student, and she did tons of research, and she also consulted with many experts in the field, and so she wrote this book, and she actually goes around the country speaking about it.
All right, well, I've looked into the literature on this in scientific sources, and I know that the American Psychiatric Association takes the opinion that there are no therapeutic benefits for any mental illness to marijuana. Furthermore, MRIs of the brain in individuals who use marijuana seem to indicate the potential with heavy use, not in everyone, but with heavy use for many years, to have some loss of gray matter and to have some decreased size of some parts of the brain, such as the hippocampus. But on the other hand, I feel I have to also ask some sort of challenging questions in this so that we could have a frank discussion. In the case of your son and in the case of Laura Stack's son, is it possible that these tragic cases involved a pre-existing depression or mental illness, and that the marijuana just happened to be a manifestation of distress? How do we know that the marijuana played a causative role as opposed to just being part of the behavior?
This is a really good point. One thing I learned about was something called cannabis-induced psychosis, which is in the DSM-5. And what I learned is that, yes, many people they self-medicate with cannabis and the high THC cannabis of today. However, what happens to a lot of young people, it's still a minority, but unfortunately, my experience with talking to other parents is there's hundreds of young people that have been affected with the cannabis use disorder and the cannabis-induced psychosis that didn't really, it wasn't really well documented before the recent extremely again high THC cannabis.
Okay, we're getting really closer to sort of honing in on this issue. I know that in looking at some of the scientific literature, for example, I think the New England Journal has done some review articles that suggest that heavy users of cannabis who are young, like high school, college students, have poor educational attainment, don't do as well in school, and there even is a suggestion that some of them might eventually emerge with a lower IQ, which is troubling no matter what we think about IQ tests and their accuracy. And so that's obviously a concern. This American Psychiatric Association, as I said, seems to take a position with respect to certain diagnoses that cannabis could be harmful, such as mood disorders, depression, bipolar disorder. But I think of psychosis, having worked as a physician in psychiatric hospitals, as being a really serious mental disturbance where you are really out of touch with reality, such as would occur with the schizophrenic. And I know that in the popular culture, we've had movies like Reefer Madness, I think, that sort of described this, and it was viewed as kind of something to make fun of, kind of a ridiculous assertion that no one becomes psychotic from marijuana. So is this a debatable issue, or is there do you feel that there's an emerging consensus that this is a problem, or is this just a very rare complication? I realize you're not from a medical perspective so much, but what do you think based on your research and your experience?
So my experience is what happened was I was doing some research over the internet, on the internet, and I found a group called Maranon, and it's a support group. And so I contacted the person by email, and I asked about the meetings, and she said there's no meetings, it's just an email chain. So I actually asked her if I could start Zoom meetings with the Maranon support group. And there was about 50 members at that time. This was 18 months ago. And now we have almost 800 members. So as far as an experiential situation, I've spoken to hundreds of parents, communicated with all these parents who's, again, it's usually 15 to 25-year-old children that are having a real difficulty with the cannabis. And again, it's the high THC cannabis. And so they're very worried, and they're so worried that they're willing to go to a meeting and the support group once a week or even more. Yeah.
So the high THC level, and THC is the chemical agent that really causes the euphoria and altered mental status in cannabis, right?
Correct.
And the high THC state, potentially one would think, could cause a higher rate of dependence, addiction, and side effects.
Right, that's what, again, these parents are saying, that's what we saw in our son.
Right.
He called it his medicine, but we saw him get worse and worse the more he used. And there's another organization called ISIC, IASIC, and the website's iasic.org, one.org. And so ISIC is a group of doctors who've done tons of research on this subject, and they have an incredible library on their website that's all peer-reviewed research. And that's one thing, when people talk about cannabis, even like the bud tenders in the dispensaries, most of the bud tenders don't have a degree in this type of area. And in fact, when they have done their studies, they found that most bud tenders do recommend it for women who are pregnant. And everything I've read, that again is peer-reviewed research, says it's not good for pregnant women.
Well, as a physician who prescribes medication for people who have chronic problems like nausea and vomiting, for example, I know that there are FDA-approved medications that we have at our disposal to treat those conditions. As a matter of fact, some of them may even have some of the effects of compounds in marijuana to treat nausea and vomiting, for example. and we have effective agents to treat glaucoma and other conditions. And one of the things that's troubled me is that marijuana as a plant is not the same as a pharmacologic agent approved by the FDA, in the sense that if I prescribe, for example, a specific agent to prevent vomiting, it may have a specific compound that we could identify and quantify precisely. But in a plant, as is the case with tobacco, you may have tens of thousands of compounds. And in fact, in preparing for the show, I looked at some literature from the, for example, the American Lung Association. And there's no scientific reason to think that the irritant and potentially damaging effect of marijuana smoke would be that much different from that of tobacco smoke. Now, the literature surrounding lung cancer does not show a correlation that's quite as definitively demonstrated to be present. And so that could be used to suggest that perhaps it's not as harmful. But I'm troubled by just the irritant and toxic effect of the smoke on other organs, and also secondhand smoke on other people. I travel a lot to go to different clinics, for example, in different parts of the state, and I frequently find myself inhaling secondhand cigarettes, marijuana smoke, whereas if it were cigarette smoke, it wouldn't be allowed. So I know you're interested in the psychosis issue with marijuana, but which may be fairly rare, I'm not sure, but it's out there. But what do you think about these other issues? I mean, isn't it strange that you can't smoke cigarettes anywhere, but you could smoke marijuana in a lot of places? I find that troubling.
Well, it's interesting because when I did study about tobacco 100 years ago, tobacco was considered not addictive, healthy. It was very cool to smoke cigarettes, even up to 50 years ago. And it also was marketed to young people. So if you look at cannabis today and marijuana, it's marketed to young people through candies, vapes, flavored vapes, and also so many people think, oh no, I don't smoke. And then I'll ask them, do you smoke marijuana? Yeah, but that's not smoking. So I think it's interesting how when you compare it to tobacco, even probably 50 or 60 years ago, it's very similar attitude. Yeah.
Right, and of course advocates for medical marijuana or cannabis would say you also have other compounds like CBG, I believe, and you have tinctures, you have vaping, you have other ways of administering it. But again, the issue of quality control and consistency is there, as well as the issue of being approved by the FDA. Do you have any thoughts on this?
Yeah, I do. I went into, not a dispensary, but to get my medical marijuana card. And it took me about 1 minute. I was just curious. So I just said, I have some back pain, and she asked me a couple questions, and then in 1 minute I had my marijuana card. And that gave me 1 year's worth of approval to get medical marijuana. I've never gotten medicine like that from my other doctors. It's always prescribed how much, how long to take it, and come on back, let's check, see how you're doing. I didn't get any of that from this doctor.
And while we're on the subject, Bart, I also found evidence looking at the scientific literature that smoking marijuana, I'm not talking about vaping or using tinctures, but it seems to at least convey or confer something of a higher risk of myocardial infarction or heart attack, stroke, and irregular heart rate, atrial fibrillation. And also there's a rare but very serious complication called hyperemesis, which is vomiting seen with it. So, I do share a concern about the possible harmful effects of marijuana. And I kind of bristle at the fact that the efforts to legalize marijuana involved giving it the sort of stamp of approval of being medical. As a human being, I could kind of understand a purely civil libertarian argument that says, we should be free to do what we want without the government telling us what to do. I understand that. I'm even somewhat sympathetic to it. But I think when the medical community was used as a kind of way to get a foot in the door for legalization, that troubled me a lot. So I'm just sharing that as my own editorial opinion. But I wonder if you might comment on Senate Bill 1097.
Right, so that Senate bill is about labels. We have labels on cigarette packages. We need labels, I think, on cannabis products. And because, again, most people don't know about the possible harms of cannabis. So what I did is I was in a press conference, let's see, about a week ago. My wife went up to Sacramento, and I went with her, and she testified in front of the Senate, and actually it passed by one vote through the Senate to get labels on marijuana products. And so now it goes to the Assembly. So we're trying to get labels.
So does this have a parallel to chewing gum flavored vaping products, or, you know, Camel Joe with Camel cigarettes, the cartoon character, I forget the exact name.
Oh, Joe Camel.
Joe Camel, yeah. In that, is this an effort to kind of appeal to young people that you're trying to kind of get in front of?
Yeah, we're just, again, we think that it's important for the public to know what are the possible negative side effects. And, and so we also think, on a different level, people that I've been volunteering with, that there shouldn't be candies that are laced with THC. It just doesn't make any sense. Thousands of kids, little kids, end up in the emergency rooms and the ICU, in the hospitals, because they eat candy that has THC in it. I know, of course, that they can't buy it and all that, but it's very easy to forget that it's out there, or after a party, you maybe don't clean up 100% like you should, and the kid wakes up, sees it there, maybe half a gummy and eats it. And so I don't think it makes sense to have candies that are laced with THC.
So we're talking about really a potential toxicity that could be inadvertent to children by diversion of products, not to mention secondhand cannabis smoke.
Right.
And I think that's actually a very important issue of concern. And I understand also that at Marijuana Anonymous, you provide support to people who are trying to deal with this problem. I'd like to ask you about that, but first, before we move on to that, this is kind of a social justice issue too, isn't it? I mean, we've discussed this, but tell us about your view of like the history of some inner city neighborhoods that used to perhaps have a lot of liquor stores. What's going on now?
Well, I think unfortunately some people just say social justice, we need as many cannabis dispensaries and cannabis stores as possible in areas that have a lot of liquor stores and say communities of color. And I've never spoken to any parents, no matter whether they're African American or Asian or Hispanic. I've never spoken to any parent that wants their teenager or young adult to be using high TH cannabis. And if you go into the dispensaries, most of their products are high THC, very potent cannabis. So I don't understand how that's a social justice argument.
Right, as opposed to having community centers or grocery stores.
Correct.
All right. And I know that I have a colleague who was active in trying to, I believe, set up cannabis dispensaries in San Francisco in the Chinatown area, and the local community was not receptive to that, partly because of the history of the opium wars and the harmful effects of drugs in China that led to a very negative view of it in that cultural group. So I guess it really can be influenced by culture too.
Oh yeah, very much so. And also, big cannabis is like big tobacco. In fact, Altria, one of the biggest tobacco companies in the world, is heavily into cannabis. So it's basically big cannabis and big tobacco, and it's follow the money, and that's why in places like California, Colorado, and other states where it's legal, you really don't hear much of the scientific side of it, or again, the peer-reviewed research. You hear about how great it is and what's the benefits of it, because it's follow the money, because there's billions of dollars.
I must say too, I am sympathetic to someone who's dealing with a terminal illness, who finds some solace in using cannabis, who I don't feel it's up to me to criticize that. But as we begin to get short on time though, do you have any broader thoughts from your expertise and experience about sort of the future of where this whole discussion will be going in a minute or two?
Sure. It took years and years for people to come around about cigarettes and tobacco. I think it's because it takes years and years for people to get lung cancer and emphysema. Unfortunately, with high THC cannabis, after one hit or 5 hits of 80% or 70% THC, people can, especially young people, they can experience cannabis-induced psychosis, and they can get in a car. It's very dangerous. They can kill themselves, kill others, and I've just noticed that. I think that what's going to happen is as more people are affected by this, that my hope is that people will again do the research and not just listen to the big cannabis companies.
I do think also that the issue of driving is very important. And one of the things I think some organizations are pushing for is a more consistent approach to determining when people are impaired from cannabis, which affects your spatial recognition, can make speeds appear to be different than they are, and so forth.
No question.
Yeah.
One of the websites that I also go to is everybrainmatters.org. And on that website, there's a woman, and she lost her daughter
Right.
to a THC high driver, and I know of another person who lost their sister to a THC high driver.
Well, Bart Bright, as we close, I'd just like to say, first of all, that I'd like to express my personal condolences to
Thank you
for the tragic loss of your son, Kevin. And also, I'd like to say how much respect and appreciation I have for the fact that you've taken this tragedy with your wife and with others and really sought to become an educator of the public of the potential harms associated with cannabis use. So thank you so much for joining us, and I hope you'll come back and visit us again sometime.
Thank you, Dr. Scott. Really appreciate it.
Remember, here at Health Focus, we focus on your health. When it comes to the issue of cannabis use and marijuana use in youth, obviously there's grounds for real concern and caution. In adults, this is clearly a more nuanced and developing issue. For any particular concerns about your specific situation, I recommend you talk to your healthcare provider, and we are not offering any specific recommendations on this show. But we appreciate you joining us as we've discussed this potentially controversial issue, and we hope we can continue to shed light on it in the future. Thank you so much for joining us, and stay healthy. Thank you.